So a lot of people will ask me, it sounds too good to be true. It isn't. It is true. There's actually less of a cost to employees than if they were to have the same procedure here in the United States. Truly, we have many employees who will tell us, I'm staying for my job, but I'm staying for my benefits. And this has kept me here.
Hi, everyone. My name is Kumar Dharmarajan. I'm Chief Medical Officer and co-founder of World Class Health. We're very lucky today to have Kate Verbeck, the Director of Total Rewards at HSM Solutions. She's seen destination medicine programs live for many of her employees, and she's in a great position to tell us more about what these programs are like for employees, the benefits they have, how they operate in practice. And we're really excited to have her today. Kate, great to have you.
Thanks for having me. I'm excited to be here. It's a great program.
We're excited to have you. So let's start really broad from the beginning. How did you first get acquainted with destination medicine for employees?
Great question. So I was lucky enough that happened to be with a new job. So I was looking to leave my previous employer. HSM Solutions, where I am now, had this program in place. My predecessor put it in place over a decade ago. And to be honest, I was lucky to, I'll call it, inherit such a great program and then be able to learn about it, help it grow, work on where we want to go next. And it's really afforded me a lot of opportunity to see how the impact it can have on benefits itself, ROI for a company, as well as ROI for employees and family members who utilize the program.
That's really interesting to hear. And you sort of were lucky to walk into it, but you talked about employer ROI, employee ROI. Can you first tell us a little bit about the program itself? What services are offered? How do employees engage with it? Maybe walk us through that.
I'd love to. It's a great program. We have a couple different pieces to the program. We have a physical piece, a surgical piece. We also have a pharmaceutical piece to it. And basically, we work with a vendor that helps us with doctors out of Costa Rica that work through Costa Rica. A couple of which actually have been educated here in the U.S., but they work through Costa Rica. And we're a manufacturing company, but we send employees for a variety of conditions, everywhere from musculoskeletal, gastro conditions, hysterectomies, obviously for women, as well as neurological disorders or things that require surgeries for neurology, as well then also for certain prescriptions. We're fortunate enough to be able to partner with them for certain high cost prescriptions. And the program itself is phenomenal for us in that our employees basically work with us if they're interested or if they have a condition that they think might warrant going to Costa Rica or Mexico, depending on which the procedure and the doctor. We'll meet with them. But one of the benefits of our program is the doctors actually from Costa Rica will actually come up 2 times a year and go on plant site visits with us. So I'll take them and we'll go visit locations and they can actually meet employees, get eyes on them. The employees can lay eyes on on the doctors and really feel very comfortable with it. That this is, somebody that they're at who may be doing a surgery for them, but they know this person personally. It's not just this is this doctor assigned to you. And the doctors will physically examine them. But also in addition to that, we have I call it regimented program in terms of making sure the candidates who go are really ready to go to Costa Rica. It makes sense for the procedure. It makes sense for their recovery. And there isn't too much, that would impact anything other than they're just going for their procedure and coming back.
How are employees even made aware of this program? How is it integrated into what they even consider for their health conditions?
So we talk about it a lot. We do 2 site visits a year with the doctors from Costa Rica, and we pick plant locations based on when the doctors were there last or employees we know who've expressed an interest. So when the doctors come back in October, we have a group in Michigan or Wisconsin rather, that hasn't seen the doctors in a while and really wants to because they have some conditions they want to talk to the doctors about. But the employees hear about it through us, through our HR representatives at the locations. But we're talking about it quite often. We put it in our benefits guide that we have this program. And when we discuss open enrollment, clearly we were talking about it. And it does have a big impact on their costs. The way we set it up for them for the global medical program, there's actually less of a cost to employees than if they were to have the same procedure here in the United States. Not saying that one is better than the other to do. Obviously, it's what's best for the employee. But in terms of they don't have to pay for their travel, they don't have to pay for their companions' travel. So they're not taking on additional costs to have these procedures done out of the US. And even though it's not global, we do actually partner with some sites in the US that do very similar. We just work with them directly.
And I know you're involved in manufacturing. And so I imagine you have a number of potentially blue collar workers. And we know that costs could be expensive and a burden for folks who are not making a ton of money, whether they're copays or deductible. How is having a benefit structured where there's reduced copays, participate, or maybe you have zero copays? How does that help drive engagement? Maybe you can speak a little bit about your employees and how setting up appropriate cost structures here contribute or not to the success of the program.
So there is no cost for any of the travel or any of the expenses for the employees. And their copay is essentially waived when they have the procedure done. So we take on the full cost of their procedure, depending on what recovery is required in terms of physical therapy too. When they get back, or even before they get back, let's say they're going for a physical procedure that's not a hysterectomy or gastric bypass, something that requires physical therapy afterwards. We work with the physicians and our vendor to determine how much physical therapy is necessary when they get back. If they have a physical therapist in mind or that they've used before, they're more than welcome to use that as long as the physical therapist is in our network. And we also work locally with some physical therapists who will see our employees or their family members when they come back from Costa Rica. So there's a lot of coordination that we do that even if you were to have the procedure in the US or not part of this program, that wouldn't be done for the employee or whomever in their families having it done, that we do that not only saves them money, but also time and coordination of benefits and pieces like that. So there's a big lift on our part as employers and caregivers to make sure that it's truly seamless for the employee. And personally speaking, as you know, my family member actually had to go to the hospital in the US to have a procedure done. There's a lot that comes with that. So it's nice to know that someone else is helping take care of that, especially when it's, as it's planned in advance.
And from that support perspective that you're mentioning, how do employees react to that? Do they value the support the program provides or HSM provides around the benefit? And what parts of it do they find particularly valuable from a coordination perspective?
It's a great question, and they value it tremendously. It's one of the things when we ask for feedback, in our benefit guides, we put comments, true employee comments on things. We ask for people to give us quotes about things that they feel about our programs. And a lot of employees will give us pieces about our medical program, specifically the medical tourism program. And they will comment on just how cared for they felt by using the program, by going through the program. The coordination from the get-go of, okay, I need my medical records just to be reviewed. That's taken care of. Let us know where we need to get them from, or they'll send them to us. And then from that point on, it's not that they don't have anything to do, but it's very seamless in terms of we even help them. We take care of their passports for them. So a lot of our employees never had a passport before they would venture. So we do everything except take their picture because we can't take their picture, but we coordinate the passports with them. And you'll see like some of the testimonials that either are in our benefits guide or that employees give us. They love all the pieces of it, and it sounds silly, but some of them will even comment that, I love that there was a sign with my name when I got to the airport in Costa Rica, because they felt like they're getting the right treatment. Somebody's watching out for them. We have one employee comment, I've only ever seen that in the movies. And it is that whole experience where, yes, you are going for a medical procedure, but we want it to be as stressless and seamless as possible. And they definitely do recognize that. And I think another testimony to it is we have employees who go for more than one procedure, not at the same time. Well, unless it makes sense to be at the same time, but will approach us and say, I need to have this knee done. I need this, I have this shoulder issue as well. Even hernias. We'll have employees who will go back and have a hernia repair done because they had their knee done, but now they have a hernia repair and they already know, they've met the doctors, they know the program, they're very comfortable with it. And one other thing, Kumar, as silly as it may sound, employees really love recovering not at home. Because right in the US, you're in the hospital a day. Maybe they send you home the same day or 2 days. When you look around and you're faced with your laundry, who's going to cook me dinner? I've got to clean up the dishes. And when they're part of the program, we do cover their hotel and food. So it's one less stress and work so the employee can just heal. And we hear what a benefit that is, and we know it is.
You're right. That's a big potential opportunity, which is the whole recovery process. This is my personal opinion, but I generally feel like hospitals and our health system doesn't really support recovery. We're woken up in the middle of the night, draw blood on us multiple times a day. We don't necessarily know what's happening. We share a room with another sick patient. And this is from the perspective of a physician. All of that is potentially stress-inducing. The food may not be great. And so I do know that in these destination medicine programs, because the price may be much lower abroad, there's not only an opportunity to spend more days recovering, let's say in the hospital or the hotel, you can also provide more services. Do patients ever talk about, really employees, but patients as well, what is that recovery like? Are they getting services brought to them? How do their companions feel? Because we didn't really talk so much about the companions, but they're part of this process too. And I think they're part of the recovery process as well when you have the right person supporting you through it. But maybe talk a little bit more about recovery and the companion that are part of good destination medicine programs.
So we do, we strongly encourage every employee to bring a companion over the age of 18, an adult to go with them, and we pay for that companion to go. The feedback we've gotten from the companions is also very positive because they get to focus on whoever is having the surgery done. In some cases, the companion is the employee, and because it's their spouse or child, depending on the procedure. So in some cases, it will actually be the employee as the companion. And we like I said, we pay for their food and their hotel. And from what we've heard, and when I've gone down to visit employees that have just had procedures done, they really like the care they're given. So we try and make sure that most procedures are either same day or one night. If you're going for a procedure for us right now, it's just same day or one night in the hospital. And then you're recovering in a hotel. And it's a suite. So you have some of the comforts of home, a mini kitchen, a living area and a bedroom and a really big bathroom because we want to make sure that there isn't any issues with someone who just had surgery having to be in a small confined space. And what we do here is that makes a difference for the employee or whoever is the person having the surgery, but it also makes a difference for the companion. While the hotel itself provides food, having the little kitchen area makes it easy to, again, assuming it's not a gastric bypass, have a snack in your room, have drinks available for you. As far as recovery and what happens after, in most cases for our employees, there's an on-site nurse or case manager who's assigned to the employee. That person meets our employee or their family member, at the airport from when they arrive and basically is with our employee the entire time. That person, the caregiver, sits with the caregiver or the companion while the employee or person is in surgery and then visits every day as well. And then if physical therapy is required while they're at the hotel, which in most cases, there's usually something required, again, for shoulder, knee, hip, that kind of thing. They come to the employee at the hotel and work with the employee and the family member and help the family member, see firsthand what they're supposed to be doing. So it's really it's a comprehensive program, but it's not overwhelming either. And again, I think a part of what makes it not overwhelming is you're not burdened by the first couple of days of being home after surgery.
I totally can understand that. I've had family members with surgery and they're home within 1 or 2 days, as you said. They're in we're trying to navigate physical therapy and doctor's appointments, and they're having to leave their homes soon after surgery just to get there. And it's a big challenge. And being able to recover in a place where your kids are around, needing help from you, or, where you don't have to worry about your job or cooking a meal can be a big benefit to someone. So let's pivot a little bit. So I think you gave us a lot of context on the patient experience, the companion experience. How do you think about the program as a retention strategy for your employees? What are your employees telling you about having this option as part of their healthcare benefit?
Truly, we have many employees who will tell us that our benefits, now we have a broad spectrum of benefits, and we do a really good job with our benefits. I will say that, but our benefits is what keeps a lot of employees. And we do hear that. But from every employee who's taken part in the global program, the medical program, and they tell us when we're there, for open enrollment visits, because we do visit every site at open enrollment, or if they need another procedure, they'll let us know. I mean, I'm staying for my job, but I'm staying for my benefits. And this has kept me here, or this has made a difference for me. And while a lot of people will tell us too, they had offers elsewhere, other plans, other corporate jobs. But this program in general and our benefits in general really do help with retention, and they help with the overall feel of what our corporate culture is, which is really to take care of our employees and their family members. And they feel that. But this program definitely makes it easier to say, this is how we're doing it. It can be very hard to do that with traditional benefits, right? Especially you have your UHCs, your Cignas, nothing against them, but it's hard to individualize and personalize. And these programs do that. And employees really, they see the value in it, but they also know that it's not something that's offered everywhere with as much as it should be, in my opinion. And I love it. And it should be offered everywhere. It's not. And they know that. So it's, in some cases, it's not worth leaving this job or this company to go somewhere else and not have those benefits.
That makes sense. In light of that, the value of the program experience, which you helped describe, are you able to give me a sense of what proportion or percentage of the employees who need to have a procedure that's covered by the program avail themselves of it rather than having that procedure done locally? Do you have a sense of that?
I do. I think it's around 20 to 30% of the surgeries that could happen are done through the global program, through the medical program. We have had a recent uptick in the last, I'd say through 2024. I think there's a couple reasons for that. One, post-COVID, people are getting more comfortable taking care of themselves again. And also, I think that has helped a little bit that people want to explore a little more. So maybe some that had inhibitions about leaving home to have a procedure done are kind of a little happy to try something different. But I also think, to be honest, inflation or whatever you want to call it has played a big part in that, because things are so expensive across the board, whether it's groceries or gas. People are looking for ways to save money. And while you don't think of it, but not having a copay or spending $3,500 on your medical for a procedure here in the US where you've never met the doctor before, or your, physical therapist is suggesting you go have surgery and you meet the doctor, same amount of time you'd meet our physician, but then you never see the doctor again afterwards. And I know you're a doctor, so I'm sorry, but it's just different through the insurance. So I think that is playing into some of the where we're seeing some of that uptick. And I wouldn't be surprised if we're starting to exceed some of those numbers, is all those factors contributing to the program, as well as the fact that our program is one of the best programs and we're very proud of it. And employees, word of mouth gets around, and my predecessor, Tim, did a phenomenal job before. And I continue that with just trying to make sure that we talk about it, that we, make sure that people are aware of what's available to them. We don't require anybody to do anything, obviously, that they don't want to do. So it's really a choice. Nobody feels like it's something they have to do. It is solely a choice. And I think that helps a lot with knowing that we as a company have your back. We want to support you. We want to do whatever makes you feel comfortable and is best for you, and support them along the way. And I think that does help people try it. If you're not being, I don't want to say coerced, but you're not being told you have to go use this particular, or insurance companies a lot of times will tell you have to do this or something. I think the employee choice makes a difference too as to why people select it.
Yeah, that makes a lot of sense. I'm really struck by I know it's your estimate, but really struck by the 20 to 30% of employees who
Surgeries.
under
I do want to prep.
yes, exactly, of the employees who are undergoing specific surgeries that are covered under the program, and we know it's not everything. The more common outpatient procedures, orthopedics, bariatric, etc. How have you been able to achieve that? And I mean, that's a big number. Many people don't think that's a number that's achievable for folks to actually travel for care, but there you are. You do have that
Mhm.
performance. How have you been able to create the trust with your employees? And the vendor probably has contributed to this as well, but to get to that 20 to 30%, how have you achieved that?
So there's a couple ways. I mean, the vendor has contributed greatly. The interaction with the nurse case manager who handles things from the beginning is definitely a reassurance for them. I think the doctor visiting for a lot of employees or their family members is a big help because they get to, like I said, see the doctor ahead of time. But also, not only do we encourage the conversation about it, we talk about it, we encourage the conversation, we put testimonials in. We have employees who just are so proud of themselves for going through the program, for having the procedures, for feeling better, like they actually don't hurt anymore. And they come home and I mean, they hurt when they come home because they did just have surgery 9 days ago. But when they get through that, they want to talk about it and they will talk to each other and they will ask each other questions because it's a plan. So people talk. So I think all of that is where the program has taken off and allowed to take off. And I'm not going to say there aren't um, I call it issues. It hurts after surgery, whether you're in the US or whether you're in Costa Rica. And I know we hear all the time, am I going to be able to fly home? Is it going to hurt to fly home? And we take care. I mean, we take care of you. Again, we're not sending anybody home that is not ready to fly home. But most, if 99% of employees fly home or 99.9, fly home as scheduled. We know the dates ahead of time, the recovery. We actually, for employees who go to Costa Rica, we organize a day trip for them the day before they come home so that they're aware, like they feel better and they know it. They're not just seeing their physical therapist while they're there. They're not in their hotel room. They're not walking around town. They're out of their element a little bit. And that day trip where we provide a van that picks them up and they know the driver because it's the same driver who's been taking them to and fro when they need to. They get out, they get to see, they walk around, they realize, okay, I am feeling better. And that gives them a lot of that confidence they need to then board a plane and come home where they might be very nervous about, I don't want somebody to hit my shoulder. Nobody does. Or, is it going to hurt to sit still or anything like that? What about bumps in the road, getting to the airport or something? Because I know even after my husband's gallbladder surgery, I was like, I don't want to drive him anywhere. I didn't want to go over a bump. So yes, digress. But I think all of that contributes to why we do have 20 to 30% of the appropriate surgeries in part of this medical program is just because people do share the experiences and that we talk about it so openly and that it's not something that we try and, oh, we're not going to talk about it. We talk about it and we highlighted it. So I think those are the biggest examples.
I think that's amazing hearing about the transparency around it, helping patients work through what to expect, supporting employees, talking about it amongst themselves so they can be real with each other.
Want to also add, managers are very aware. So, we're a plant environment. When someone's not on a piece of equipment or in the plant doing their work, it has an impact. But the plant managers and, leaders are all aware, one, of the program, and two, what's required from the employee or their family member and the timeout they'll need. So it's all arranged. And some of that's, again, that high touch through the case manager, but it's at every level that the communication is there. And that really helps tremendously because there isn't I need to take 12 days off to have this procedure done because I'm going to be in the hospital and then physical therapy and, how quickly can I come back to work? There isn't that feeling from employees because they know that this is something we provide, this is supported, and they're encouraged to do it.
Makes a ton of sense. I want to ask you one more question. Given everything you've said in your experiences to date, What do you tell other HR benefits leads about destination medicine when you talk to them about it? Because I know you have a number of roles where you connect with others on the topic, supporting healthcare benefits, innovation more generally. What are your conversations like? What do people ask you, and what do you tell them?
So a lot of people will ask me, it sounds too good to be true. It isn't. It is true. People will say, is it even legal? Yes, it's very legal. People do, even at HR levels or, the level of the person making the decision, there's concern that something seems to be too good with a program. If it's too good to be true is a lot of and when I explain it, you can almost see the light bulbs going off that while does sound too good to be true, it's actually something that's not only doable, but maybe we should be doing. And I'll embrace the conversation with just asking, either other peers, how come you haven't looked into it or have you? And what's stopping you? And the start is the biggest stop. People don't know where to get started. And it's just becomes this, I don't know, I've heard about it. Um, and I'll have conversations with other peers just about, okay, well, you can start small and then grow larger. You don't have to start with every procedure. We certainly don't. And I think that gets people engaged and excited about it. It's then how do you keep that momentum going when we're not having that conversation anymore? Because what they've always done is working, but is it, truly? I mean, it's working for some things, but there's so many other opportunities now that sticking to what we've always done isn't always the best case. And no leader likes to hear that they're leading that way, which I hate to say because I don't want to get in that mind frame, but it really is something that's a development piece of programs. And what's the next step? And how can we do it also to make it better for our employees and their family members? So it's takes the conscious effort of the leader, but it's also a recognition that once I get started, um, it's not the struggle I think it's going to be. It's just like implementing any new program is challenging, can be challenging and time consuming. But I want to say very few have the rewards like this one.
That was a perfect way to end. And love that you index on the patient, the employee, the family member, because at the end of the day, that's what this is all about. And this was wonderful. Very appreciative of your time. And I look forward to staying in touch and learning more from you as your experience goes on with Destination Medicine.
No doubt. I'll let you know what procedures we add too, because we're always looking to grow.
Sounds great.
Thanks.
Take care.